Hello everyone. Today, we're diving into the world of a medication called Fluticasone, commonly known by its brand names Flonase, for nasal use, and Flovent, for inhalation. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Fluticasone, available as Flonase and Flovent, is a corticosteroid that reduces inflammation in the body. It comes in two main forms: nasal spray, Flonase, for treating allergic and non-allergic nasal symptoms such as congestion, sneezing, and runny nose, and inhalation, Flovent, for managing asthma symptoms. By decreasing inflammation, Fluticasone helps to control and prevent nasal and respiratory symptoms caused by allergies or other irritants. Warnings: while Fluticasone is effective for many patients, it comes with certain precautions. It is not intended for use in those who are allergic to Fluticasone or any of its ingredients. Those with a history of severe allergies to steroids should also exercise caution. It's crucial to avoid contact with people who have infections, such as chickenpox or measles, as Fluticasone can weaken your immune system. Long-term use may increase the risk of developing osteoporosis, glaucoma, or cataracts, so regular checkups with your healthcare provider are recommended. Before taking this medicine: before starting Fluticasone, inform your healthcare provider if you have any infections, a weakened immune system, glaucoma, cataracts, liver disease, low bone mineral density, or any nasal problems, if using Flonase. If you're pregnant, planning a pregnancy, or breastfeeding, it's important to discuss this with your healthcare provider. Regular monitoring and follow-up visits are crucial to ensure the medication is working effectively and to manage any potential side effects. You should not take Fluticasone if you are allergic to it or any of its ingredients. It's also not recommended for individuals with untreated fungal, bacterial, viral, or parasitic infections. Avoid using Flonase if you have had recent nasal surgery or nasal sores unless your doctor advises otherwise. Side effects: all medications can have side effects, and Fluticasone is no exception. Common side effects of the nasal spray, Flonase, include headache, nosebleed, sore throat, and nasal burning or irritation. For the inhalation form, Flovent, side effects may include hoarseness, throat irritation, and oral thrush, a fungal infection in the mouth. To reduce the risk of oral thrush, rinse your mouth with water after each inhalation dose. More serious side effects may include signs of infection, such as fever, chills, persistent sore throat, vision problems, increased thirst or urination, and severe allergic reactions, such as rash, itching/swelling, severe dizziness, trouble breathing. If you experience any of these symptoms, seek medical attention immediately. Interactions: Fluticasone may interact with other medications. It's important to inform your doctor about all prescription, over-the-counter medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Medications such as ritonavir, used to treat HIV, AIDS, and certain antifungal drugs, such as ketoconazole, may increase the levels of Fluticasone in your body, leading to more side effects. Dosage: correct dosage is vital for the effectiveness of any medication. For Flonase, the typical dosage for adults is 2 sprays in each nostril once daily, which may be reduced to 1 spray in each nostril once daily after symptoms improve. For children, the dosage is typically 1 spray in each nostril once daily. For Flovent, the recommended dose varies depending on the severity of asthma and age. Adults and children over May 12 start with 2 inhalations twice daily, while children aged 4 to 11 may require a lower dose. Always adhere to your doctor's recommendations and do not alter your dosage without consulting your healthcare provider. Avoid: while on Fluticasone, it's advisable to avoid contact with people who have infections, as the medication can weaken your immune system. It's also recommended to avoid using other nasal sprays or inhalers without your doctor's advice. For those using Flonase, avoid inserting the nasal spray deeper into your nose to prevent irritation. Always store Fluticasone at room temperature and keep it away from moisture and heat. FAQ: many wonder about the age restrictions for Fluticasone. Flonase is approved for use in children as young as 4 years old, while Flovent is approved for use in children aged 4 and older. However, the safety and effectiveness in younger children are not well established. Always consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Fluticasone. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.